Hi, welcome to our first digital annual report, just another symptom, I hope, of modernising our health system. It's been an extraordinary year in SA Health. We've done so much over the course of the last 12 months, particularly I think the governance changes, getting the 10 LHNs in place with their boards. It's not just about a governance change, it's about driving the system to be much more connected at the local level and less of a centrally controlled system. So those boards, those CEOs, have full carriage of those health systems, connecting better with their clinicians, connecting better with their local community. So it's a very deep cultural change that we're trying to promote there. And that's meant that the department has had to change as well to cope with that. We're focusing on long-term stewardship of the system, looking out 10, 20, even 30 years for how the system should look in the future. We wanted to make sure that public health came into sharper focus as a core part of the department's work. Wanted to make sure our commissioning was great and our corporate services are really fit for purpose. So they're really great changes. Along with those, we've also created Wellbeing SA. So Wellbeing SA is our very keen focus on prevention in terms of our health system, looking to put the fence at the top of the cliff, not the ambulance at the bottom, and making sure we give people services that are fit for purpose and keep them away from our hospitals, keep them well in the first place. And our Commission for Excellence in Innovation and Health, again re-establishing those clinical networks so our clinicians can join from right across the system and look at what are the emerging innovations and opportunities for clinical improvement, as well as getting us ready for the digital economy of the future like every other part of our economy. So they're massive parts of change in our system, which I'm really excited by. Of course, the biggest thing confronting us is the increasing demand for hospital care, and while we know we need to meet that and we want to make sure that our hospitals are fit for purpose and can be really efficient, and that's partly not operating at 100% all the time, but we've also opened some new beds in other areas and we're looking at services that meet people's demand where it's best met. And sometimes that means it's not an emergency department, but it's a priority care centre or getting hospital level care in your own home. So these are shifts to rebalance our system so it's fit for purpose right across the continuum. These things all happen because, you know, of the outstanding staff we've got, and I just want to finish by acknowledging our terrific clinicians from right across the system, the doctors, the nurses, the allied health guys, as well as the administrators who are a very important part of our system. So once again, thanks everybody for the help you've been throughout this year, and really look forward to I think a fantastic world-class health system going forward.